Okay, good evening, everyone. My name is Andrew. I'm one of the social workers here at the Cancer Center, and welcome to our Palliative Education Day. Today's topic is called Beyond the Bubble, and the focus will be on caregiving from afar. So first of all, I'd like to thank everyone who took the time to attend this evening. I understand how challenging it can be to find time in your day and to take time away from your responsibilities. So I wanted to personally thank you all for taking the time to attend. Okay, we'll start with a quick little introduction. So for our agenda today, we'll start with a bit of an introduction into caregiving, followed by some tips and strategies on how to become better communicators, not just with our loved ones or care receivers, but also with our support systems, our care teams, and anyone involved for that matter. We want to focus a little bit on self-care and how we can better take care of ourselves. And we will set some time aside at the end for questions and answers, but feel free to chime in via the chat with questions along the way. If you're worried you might forget them, and if we do have time amidst the presentation, then we will address them as we go. Otherwise, I ask if you can please keep them until the end. I should note that our session is being recorded. So for those who weren't able to attend tonight, feel free to share this with them or reference it yourselves if you're in need of a bit of a refresher. So recording will be made available for you after the presentation. Okay, to start off, I thought I would tell you a little bit about myself. I am a social worker, like I said, here with the Windsor Regional Cancer Center. I obtained my degree in social work, both my bachelor's degree and master's degree, from the University of Windsor in 2012-2013. And I am a registered member of the College of Ontario Social Service Workers and Social Workers. I've been an employee of Windsor Regional Hospital now for about 7 years. Started my career in acute care, meaning in the hospital itself. My role mainly being helping patients and families with discharge plans for when it was time for them to leave the hospital, and coordinating services and resources to ensure they were well cared for at home and successful in their journey. Most recently, I've become a member of the Windsor Regional Cancer Center team in January of about 2018. In my time here, I've enjoyed working with our patients, their families, and providing supportive and counseling services, helping them navigate the healthcare system. As we know, it can be quite complex, confusing, and complicated, and as well as to help with a lot of different practical needs, as we know that the logistics surrounding treatment and treatment planning can be quite overwhelming and overburdensome. I am partly involved, or I should say involved, with the Windsor Essex Community Health Center as a co-facilitator of our Powerful Tools for Caregivers workshop. What that is, it's a 6-week series that offers tips and strategies more in depth on how to become better caregivers, and we'll provide you with some information of some upcoming workshops at the end of the presentation as well. And if you're interested and find that this content was helpful and find yourselves wanting more, then you can register for that series in the winter spring of 2021. Okay. So you might ask who this presentation is intended for. This being part of Palliative Education Day, it is not just meant to be for palliative patients or cancer center patients. We wanted this presentation to be universal and applicable to people in all different caregiving situations and patients in all different settings, whether that be in their own homes, in hospitals, long-term care or retirement homes, different palliative care centers such as our hospice of Windsor or the Amara Center over on Prince Road, as well as those who may be providing care to patients or other families or care receivers at a distance, whether they live in another city, province, country, or somewhere else in the world. So again, we wanted to try to keep things general for today, but a lot of the examples that we'll be providing will be a little bit more specific to our experiences here in the Cancer Center with our patients. Again, if you have any specific questions about your particular caregiving situation or scenario, you'll have an opportunity to ask that at the end of the presentation and to get some input and potentially even some advice from us. Okay. Now, you might ask, what it means to be a caregiver and what caregiving is. And it's important for us to recognize that caregiving comes in all shapes and forms. Caregivers, take on various roles within those relationships. And sometimes it is comprised of many different individuals providing care to one person. So it can be a very shared experience, but a very unique experience nonetheless that comes with its own set of unique challenges. In identifying that, we'll move forward and talk a little bit about those challenges in particular and ways we can look to overcome them. Okay, first off, it's important for us to acknowledge the impacts the COVID pandemic has had on caregiving, hence why we're doing this presentation today virtually. We know that the pandemic in itself has more or less made a difficult situation even worse, not only for our patients, but for us as caregivers and our ability to provide good care. We know that there have been a lot of barriers created by the pandemic. Again, our inability to meet physically and in person. It's created a lot of social isolation and social distancing that has, again, made the physical aspects of providing care very difficult. And it's also related or caused a lot of issues and obstacles in communication. We've seen a lot of different restrictions in different agencies and organizations around the community, where individuals have not been able to come to appointments in person and have had to rely on means of telephone or other virtual means to communicate, which we know has been particularly challenging, especially for those who may not be as technologically savvy or familiar with some of the technology that's available. We know that it has added another layer of risk to those who already have pre-existing health issues. Here at the Cancer Center, a lot of our patients who are just finishing or in the midst of receiving their chemotherapy treatment are already at risk for a lot of community-acquired infections, us coming into flu season being one of those concerning times. And we've seen a lot of programs and resources either suspended, eliminated, or even put on hold for the time being as a result of a decrease in volunteer involvement, all for the sake of keeping everyone safe. So we do want to emphasize the importance of safety and how we can all play a role in keeping ourselves and our care receivers safe while, again, providing good care. We're going to talk a little bit about knowing how we can become aware of some of the rules of different agencies, organizations, hospitals, and then how important it is to know these rules before you go. So that is our little catchphrase about knowing the rules, is to know before you go, because we do find that surprises can only make situations even worse. And of course, the rules can change. Okay. Now, as a result of COVID, we've again found ourselves now providing care at a distance and in many different ways. Some of the responsibilities involved in caregiving will be, again, touched on in more detail in some of our future slides. But we're going to talk a little bit about how we can access resources and services, even though we are, again, not physically present or able to access them in the same way, as well as some strategies for how we can delegate tasks and still be a voice and an advocate for those who need one. So again, being at a distance has really put up some barriers and some challenges to how we can fulfill these specific roles of caregiving. Okay. Now, with that being said, we want to, first of all, touch on how we can become better caregivers by, first off, becoming better communicators, specifically communicators with our care receiver or our loved one. The key, of course, to any communication or any effective communication is assertiveness. And what is assertiveness, you ask? Well, assertiveness is more or less finding that middle ground. It's kind of the balance between aggressive and passive communication. And again, you're probably wondering, what are aggressive and passive communication styles? Well, aggressive communication, more or less, is ways in which we say things that come across as being offensive or can more or less be perceived as threatening and get someone's back up. Whereas passive communication, we tend to ignore our feelings or put them aside or just leave things unsaid or unaddressed, which can create feelings of harbored resentment and neglect for ourselves and our care receivers, and again, impair on our ability to provide good care. Some of the goals of communication in assertive communication, one of them being, of course, to prevent misunderstandings and misinterpretations of information. We want to strengthen our relationships with those we care for and those who assist us in providing that care. And we want to increase our chances of being heard and validated. We want to reduce our feelings of stress and frustration, and in turn, help us to problem solve by being better communicators and finding better ways to express ourselves and our feelings. One of the ways we can really achieve good assertive communication is by using what are called I messages. And you'll see on the slide, we're wanting to differentiate between the difference of you messages and I messages. And what are you messages and I messages? Now, a you message, and this might be a good example to help make things a bit clearer, would be something along the lines of, you don't understand. You've all heard that before, and it comes across as a very much so finger pointing or blameful type language. And it can just more or less keep conflict going and create, again, those feelings of frustration and difficulty communicating. Whereas I messages can help us to express our feelings, in a more positive way. Common feelings such as anger, disappointment, frustration, and we do it in a way that we aren't blameful or causing someone to become defensive. It can help us to achieve a better sense of togetherness, cooperation, mutual respect for one another, doing so in a calm, clear way, and overall just build on and create a better understanding. It involves, mutual respect for one's feelings and the right to express themselves, of course. When communicating assertively and when using I messages, we want to make sure that we're being very clear and specific when we're communicating our feelings. It's important not to give any hints. We're not mind readers. We don't know what someone is thinking. And giving hints can just cause more confusion and make things even harder to interpret and to understand. One of the things we want to, of course, try to do is to speak directly to the person we have a problem with. And we all know this all too well, where we see someone taking out their frustrations on a receptionist, a secretary, a cashier, someone who is not to blame for the issues or the cause of that frustration. We want to address those problems directly with the person that is causing us to feel that way. And of course, in doing so, we want to also become good listeners. Being good listeners shows that we care, shows that shows that we want to help, and helps us to receive better information as well by listening to what others have to say and how they might feel. So again, assertiveness is the balance between passive communication and aggressive communication, and finding that middle way by gaining and achieving a mutual respect for one another and allowing each other the opportunity to express themselves freely and to do it in a non-judgmental or threatening way. So one of the key components, of course, to providing care and communicating with those around us. By communicating, one of the things we seek to achieve is a greater understanding for what our care receivers' wishes or loved ones' wishes might be. We want to talk to them a little bit about what their goals of care are and what are their goals of care. Now, that's something we're going to talk about a little bit later as well, as it pertains to discussions that one might have with their care teams or their physicians. But it's more or less kind of the concept of identifying what is important to that person and what are they hoping to get out of their care. What are their goals? What are their wishes? What is important to them spiritually, religiously? What considerations do we need to make? How can we accommodate them? These are all questions that more or less come together to formulate what someone's goals of care are. And you'll see that terminology more and more as you enter into hospitals or physician offices. It's becoming a more widely used and accepted term, and conversations that we want to promote and see more of. Now, when making decisions regarding the goals of care, it's important to identify who is the one responsible for making those decisions. And this is where power of attorney and substitute decision maker and some of those different concepts come into place as well. For those who aren't able to make decisions for themselves, we rely on communicating with the person who is designated to step in on their behalf. That person should have a clear understanding of what that person's wishes are so they can act on their behalf, not on what their wishes might be, them as the individual. We want to see that they are making decisions that are in the best interests of their loved one or care receiver and that are consistent with what they would want for themselves. And again, it's not about what the caregiver wants for the patient, it's about what the patient wants for themselves. And we understand that that decision-making process can feel sometimes overburdensome and then quite heavy for those who feel responsible for the care and well-being of a loved one. Again, we're going to have a bit of a conversation about goals of care and goals of care with a care team in an upcoming slide, and then we'll provide some information in our resources at the end of our presentation on how someone can appoint a power of attorney. So there will be some information on accessing documentation and how to go about completing that to designate someone to be a decision maker. Okay. Now, when making decisions for or on behalf of those we care for and love, we want to make sure that we're keeping them involved in any way possible, regardless of the distance and any physical barriers to providing that care. We want to allow them to be participants in their own care when and however they are able, and to however much they understand. They may not have a full understanding of the extent of that information and what's being talked about, but maybe be able to understand some of the basics and some of the core decisions that are being discussed. It's important for us to really look at the language that we use and making sure that it is clear and concise, and that we put it into terms in which everyone can understand. We've all been in that situation where we've been part of an appointment or a meeting where a lot of hospital jargon or terminology is used, and it goes in one ear and out the other, let's be honest. No one knows what these acronyms mean. So we, not only as healthcare providers, need to be a little bit more cautious of the language that we use and the choice of words, but we also need to put things into terms that everyone can understand for the sake of making sure that it's understood and that the right decisions are being made and by the right people. In addition to keeping our care receivers involved in making decisions, we want to involve them in all aspects of family life and traditions in any way we can. We want them to do as much for themselves as possible, and the goal is to empower them and to give them more control over their life, not to take that control away. We want to see people stepping up to make decisions for themselves and to do so in a way that they're confident and unaware of what the consequences of those decisions might be, as well as what the benefits could be. Okay. Now, on that wavelength, we want to also, I want to also touch on the importance of communicating with your support network. And your support network can really consist of anyone who is part of that circle of care. And by circle of care, I mean anyone involved in providing care to your care receiver or your loved one. This could be anyone from family, friends, to other healthcare providers outside of the hospital and outside in different agencies around the community. The goal in communicating with our support networks is to really achieve a balance of responsibilities and what needs to be done. Too often do we find our caregivers feeling as though they're taking on too much, or even potentially not taking on enough, or feeling as though they're not doing enough and can be doing more for that person. And by doing so, they tend to either harbor feelings of guilt or potentially even resentment for doing too much. One of the ways that they can overcome some of these feelings is by kind of more or less establishing a point person within the family or within that circle of care, or a spokesperson, to delegate responsibilities, assigning tasks specific to what the care involves. So that might be family members dividing and conquering, and one family member taking on the role of letting one family member are delegating a task to a certain family member, one, let's say, to do the cleaning, one to do the cooking, one to take care of the appointments. So it really is more or less a divide and conquer mentality, but it's making sure that there is one person who is appointed to do all of that organization, because again, with too many hands in the pot, things can get a little bit confusing and a little bit overwhelming. Another role that the point person or delegate might have within the circle of care is to attend appointments with their care receiver, to take notes while they're there, and to communicate those updates and that information to other family members and other people who are part of that support system by coordinating family gatherings or meetings or other group meetings to share that information. Not only is it helpful to have a point person or spokesperson delegated within the family, we as healthcare providers always find it helpful to have one family member that's delegated to receive information. A lot of times, we struggle with, who information should be provided to, and as well as struggle with repeating information over and over again. What you'll find is it's much easier if we have one person that we can communicate with and have that person be the one responsible for then sharing that information with the rest of the family. Now we'll discuss a little bit more on, again, how to communicate more effectively within the care team in some of our upcoming slides as well. Okay. I should say in our next slide, not one of our upcoming slides. Okay. Now, in communicating with our care team, we want to use those same strategies for communication that we just reviewed about communicating with our loved ones and communicating with our support network. We want to maintain an assertive style of communication, even when we're in the presence of professionals. Behind the badge, behind the name tag, we are all people as well, and we all deserve the equal chance and opportunity to be heard and should be perceived as equals when we're together, even if it is for the sake of making some important decisions about one's care or treatment. One of the things we want to do is respect our loved ones' wishes, again, and what their wants and needs are. By discussing those with our care receiver or loved one, even prior to the appointment, get an idea in advance as to what they might want, what their values are, so that way it can help guide the discussion and guide some of the questions around some of those decisions, and as well as just being able to come prepared with decisions regarding treatment and certain other important aspects of their care. Okay. We'll want to initiate conversations with our care team, such as discussions regarding goals of care and why those goals are important to the person we're caring for. Again, we want to take into account their spiritual and religious considerations and what it means and what quality of life means to them. And what is quality of life? Quality of life is any part or aspect of someone's life that gives them any sense of quality. So again, what is important to them? Is it, or is it important that they are pain-free? Is it important that they have the opportunity to participate in something? What do they value? What do they cherish? And what are their hopes going forward? And what are they hoping to get out of their experience? Again, it's important to involve them in the communication process and these discussions where and when possible. It's important that they get the opportunity to speak when and where able, and again that our physicians and our other members of our care team are speaking directly with our care receiver. You'll see sometimes in a hospital room, the doctor might come in and immediately start talking with the family member who's sitting at the bedside without acknowledging the person who's actually there receiving care because of their own preconceived ideas of whether that person is even capable of understanding that information. So it's important that we really take an opportunity to communicate directly with the person who's receiving that care and to really gauge their understanding so that we can effectively coordinate that treatment and honor what their wishes are. What you'll want to come prepared to these appointments by working with your point person to identify important
questions, different things that you might want to ask, and to take the opportunity to ask those when you're there by initiating those conversations again and by requesting that you have that opportunity. It's important that you take notes and remember that there is no stupid question. Any question is on the table, and it is important that we ask all of the questions we come prepared with, or at least seek to have those questions answered after the fact if anything is missed. As a caregiver, one of the advantages that you have is that you know your care receiver or your loved one best. In fact, far better than we know them. So we rely on our caregivers to give us information about what that person's baseline is or any other medical issues or challenges that they may have experienced or been facing. That way we can identify patterns to their health challenges or just more or less create a better sense of awareness and give us that full picture as to what challenges they might be facing at home, as well as what some of the challenges in providing them with good care are. Of course, it's important that you know your rights. Everyone has the right to access their own medical or personal health information, to get copies of their medical records if they feel they'd like to have a look at them themselves. We encourage people to seek out a second opinion if they feel it's what they need or what they need to gain that reassurance that they're getting the best possible care they can have. We have patient advocates that work within our hospital to help advocate on behalf of our patients where they don't feel they're able, to make sure that, again, their wishes are being honored and that all of that information is being shared with them and that they are getting access to every option possible. Too often do we see, or do I hear of patients who are hesitant to ask about a second opinion in fear of offending their physician, when in fact that's not the case. Most of our physicians, especially here within our cancer center, encourage others to seek out second opinions and want them to do so that, again, they feel confident in the care that they're getting and that they're receiving and know that they're getting the best possible treatment that's out there. Now, when attending appointments with your care receiver or whether that be virtually or in person, it's important to ask some of the right questions and even to identify some of the answers to these questions before the appointment. You might be wondering who is part of the care team. Here at our center, we have all different disciplines that work side by side, including our doctors, nurses, dietitians, social workers, other support staff. The care team may also be comprised of physiotherapists, occupational therapists, and other community partners, such as our LIN care coordinators, and as well as our social service agencies. So it's important to identify who makes up that care team. Who is it that we are going to be meeting with, and who is responsible for what? What is their role within that circle of care? Who's providing this? Who's providing that? Who should we call for this? Who should we call for that? It's important to know when the appointments are. We know, especially in our experiences here through the Cancer Center, that the appointments themselves can be overwhelming. There are so many, and they take place every week, sometimes every day of the week. And what we provide our patients with is a little appointment calendar that they can keep track, or we encourage people to use calendars or schedules of their own. But in our resources, again, at the end of our presentation, we're going to be providing you with an appointment tracking tool as a way for you to better keep your appointments organized and better keep track of what might be coming up. We want to ask again ourselves what the goal of the appointment or the call is. What information are we hoping to receive at that appointment, and what is going to be discussed? What are we hoping to accomplish? What are the outcomes that we're looking to achieve? Are we looking for a decision about a certain treatment? Are we looking for a decision about placement? Are we talking about any decision for that matter that is important to the person's care journey? So again, we want to identify what the goal of the appointment is and tailor our questions accordingly, making sure that we're asking them and that they are in line with the information we're looking to get. So that might, and first by identifying what the appointment is for, might better help you to structure your appointments accordingly. And again, you want to write down these questions before and potentially appoint a note taker to take notes during the appointment. the information, again, can be very overwhelming. Can be a lot of information that's being discussed at one time and with many people. So that information has the tendency to go in one ear and out the other. By having a note taker, we can make sure that more of that information is captured, and at least there is something that you can refer back to if we're ever wondering what was talked about. We have had people and individuals request to have their appointments recorded, though I know that the policies and procedures are very different across different organizations, so we encourage that you ask for permission before doing so, or at least let it be known that you intend to, as there are sometimes policies that prohibit the use of recording equipment for appointments. If you find that at the end of that appointment there is still information that's not clear, you always have the right to ask for follow-up, or in our case, what we call them talk appointments, which are appointments that are created for the sake of just sharing or reviewing information. What you'll find is that your doctors and those involved in your care are more than happy and more than receptive to take the time to sit down with you and to review things again, because again, we want to make sure that information is being well understood and that there's a clear understanding of what the risks and benefits of all of these different decisions are. Finally, when the appointment's finished, take the opportunity to debrief with your support network or your family. Make a point of setting up a follow-up group meeting, a group text, or some form of some kind. I've seen some create different groups on social media where they can provide updates that can be viewed by anyone who's a member of that group. And again, it helps to avoid repeating information over and over again, or being asked to repeat that information over and over again, especially for those who either aren't able to attend or don't have the time. So just a couple little tips of how you can come prepared to appointments with your care receiver. Now again, in planning for those appointments, you want to know again who is permitted to join them. Here we are, facing a lot of restrictions on who can attend an appointment, who can even enter the building. So we have had to rely on different forms of technology to allow people to participate in those appointments when they're not able to come in person. Sometimes we've been able to offer up iPads or other forms of technological equipment so that family members or caregivers can attend by sitting in their cars or in another place outside of the building and still feel as though they're involved in that discussion and in that appointment. There are different policies in different organizations, different long-term care homes, retirement homes, about dropping off food or packages or even gifts. I know, again, with the current state in which we are in with the pandemic, oftentimes certain items are having to be held for a period of time. And of course, it's important to keep in mind, some of those items, especially those that are perishable, could expire within that time frame. So again, know before you go. Call ahead, find out what the procedure is, what the process is for bringing things over if you'd like, and as well as what the process is for attending appointments and how you can do so by alternative ways, if not in person. Okay. Now, we talked a little bit about the use of technology, and we're seeing that technology is becoming more widespread, especially more widely utilized as we continue into our anticipated second wave of the COVID-19 pandemic. We, as an organization, have gone ahead and purchased additional technology and equipment to allow us to communicate information in better ways with our patients and our families. But it's important for us to keep in mind and to recognize that information, that technology should be accessible and inclusive to everyone. I know some of our more elderly population in particular may not be as tech savvy or familiar with some of the technology or even have access to it because of what they might have at home. So oftentimes, we encourage them to enlist the support or the assistance of a family member who's quite technologically inclined,
And it's a good way to also get some of our younger generation involved in caregiving, and for them to help kind of feel as though they're participating in some way or have something that they can contribute. So again, if you have any younger members in your families, it's a good way to, get them involved and to look to them for some assistance in utilizing some of this new technology that we have. I can say that I'm probably one of them. I needed quite a bit of help today to get set up. So fortunately, I had my colleague Sarah here to make sure things ran smoothly. Now, again, on further to the use of technology, know that sometimes the numbers of devices can be quite limited, specific to organizations as well. And I know that certain long-term care homes, other agencies, even here, are using more or less kind of a reservation process to access and use that technology. So if there is any type of a process like that, you'll want to, again, phone in advance and make sure that you have the ability to reserve that technology for when it is that you need it and that it's available for you when you need it. Okay. Now, in addition to using technology, oftentimes we find that caregivers, family members are wanting to do some form of a check-in on their loved one, especially those that are prohibited from visiting or allowed to visit with restrictions, maybe only one or two family members at a time. You want to know who to contact to make those arrangements. If it's in a hospital, you may be looking to contact the social worker or one of the clerks, potentially the secretary, to make those arrangements. And or in a long-term care home, it might be the nurse or one of the administrators. So again, you'll want to kind of get an idea as to what that process looks like and what is that chain of command, especially if you're needing to escalate any of those concerns. Who should you be talking to? Who should you be addressing them with? And when and who is it appropriate to be doing it with as well? So again, as we've been drilling this in all through this presentation, know before you go. Know the process, know who you should be talking to, know who you should be calling, and make sure that you're calling the right people for the right things. Okay. Now, of course, we've done a lot of focus on our care receiver and our loved ones, as well as focus on a little bit of the communication with our care teams. And now it's time to focus a little bit on you, and to acknowledge some of the emotions that come with caregiving. And it's, of course, important to recognize that your position is not an easy one. It's full of ups and downs, but can be challenging and rewarding at the same time. You'll see on this slide just a small list of maybe some common emotions that maybe all or some of you might have experienced at one time or another. Feelings of gratitude, of guilt, frustration, joy, sadness, being overwhelmed, feeling resentful, or being worried or even potentially thankful. It's important to know that all of these emotions are normal and part of the caregiving journey and part of the experience and a normal part of caregiving, and to accept them as part of that process and part of that experience. Of course, it's important to acknowledge stress when we experience it in ways what things we can do to manage it. We want to recognize those early warning signs of our stress and our emotions and identify what the possible sources of that stress can be. So reflect on it, think about it. What causes you stress? What makes you more stressed? What are your warning signs and what are your triggers? Because everyone's are different and everyone's limits are different in what they can handle and what they can't. Identify what you can and cannot change. This is an important one. Too often do we find caregivers seeking to change something that's totally out of their control. Again, looking at an example here through our cancer center, the behavior of the disease in itself is not something that we have any control over. But we have control over what we do outside of that, with our routine, our diet, our exercise, and other ways we can take care of ourselves. We want to be able to look at the things that we can change, not the things we can't. So some of the things we can change is the way we look at things and our perceptions. Potentially, we can even change certain situations by
involving other people or offloading some responsibility or seeking help. And then we can change the way we respond to stress and the way we cope with it by getting the support that we need and by developing healthy coping mechanisms and ways of taking care of ourselves and handling our stress. Remember, when stress is neglected, it puts us at risk of other health issues, disrupting our relationships. It can cause other mental health issues such as depression, and really, again, decrease the quality of the care that we're providing when we're neglecting ourselves and under a great amount of stress. And again, further to that point, it's important that we take care of ourselves. Probably the most important aspect of caregiving is finding that time for yourself to do the things you want to do. More or less, it kind of relates back to that cliche of, you're not going to be of any good to anyone else if you don't take care of yourself, and it really does ring true. One of the things, we encourage our caregivers to do is to kind of come up with an action plan of some kind where they can somehow introduce self-care into their normal routine. Now, self-care should be something that you want to do, not something you have to do. We all have those things in our lives, responsibilities that we can't get away from, but this is your opportunity to really do something for you, and something that you really value and enjoy, and something that brings you feelings of happiness and satisfaction. It should be something that's reachable, and realistic. The goal here is that we want you to succeed, not set yourselves up for failure. So when looking at making some sort of an action plan, we want that to be realistic and to be within your abilities. You may find that, you don't have much time, so it should be something that kind of allows you to do it within a specified amount of time that you have available to you. It should be behavior specific. Saying that you're going to take better care of yourself is not an action plan, despite what you might think. We want you to be very specific on how you plan to take care of yourself. How are you going to do this, and what is it that you're going to do? It should answer questions such as what, how much, when, and how often. So again, when looking at making a plan, you'll want to think about, how often do I think I can realistically do this for myself? When do I think I might be able to find the time to do it? And how often might it be able to maintain that, or do it maybe in a week or 2 weeks or every month? So it is important, again, to be very realistic in your expectations of yourself and what you're able to do. Now, again, managing self-care is one of the most challenging but yet rewarding aspects of caregiving. It can help by maintaining what self-care actually means. The term self-care, which some of you may or may not have heard. It's a way for us to maintain the activities we enjoy and the relationships that are meaningful to us. One example would be, someone who has pulled back from a particular group of friends or has stopped doing some of the things they like because they either feel they don't have the time to dedicate to that, or they just have neglected it because they just find that there's just too much on their plate. Self-care means having realistic expectations, again, of what we can do and not trying to do the impossible. Again, do I even have the amount of time I need to do what I want to do? It focuses, again, on the things we cannot change, or can and cannot change, and letting go of what we can't. And again, finding solutions to those that we can. It helps us to deal with our emotions in a better and healthier way, by recognizing that there can be those ups and downs and to not let our emotions control us. So again, we want to set goals and we want to work towards them by taking time in our routine and in our lives to incorporate some self-care. And again, and further to that, asking for help. One of the most important aspects of taking care of yourself. We can't expect everyone to know what it is that we want. So therefore, we need to tell them and be very specific. And you can see how a lot of this relates back to some of those core concepts of achieving good communication. By doing so, it will allow us to communicate our wants and needs and allow us to put the boundaries in place we require to allow us to take the time to care for ourselves. So everything more or less kind of relates. And remember to give yourselves the permission.
I know it's easy to feel guilty for taking time away from your duties and responsibilities to take care of yourself. But give yourselves that compassion and give yourselves the permission to take care of you. Because again, our mental health is important to our health, and it's important to our ability to provide good care. Okay. Now, there are various resources within our community and various outlets where we can achieve support or obtain support and help us to become better caregivers. And this kind of falls into place with self-care. There are various support groups nowadays more than ever, the presence of virtual support groups and forums. Some of these groups might be very disease specific, and some examples of those within our own community are services and resources someone may obtain through the Alzheimer's Society, or potentially certain support groups through social media outlets like the Pink's Breast Cancer Group, which I know a lot of women belong to and find to be a great avenue to not only have the ability to voice their concerns, but seek out support from others who can relate to that shared experience. It's important to be aware of mental health services and counseling and therapeutic services within the community and how you can go about accessing them. Those that are both covered and those that are private pay. Here through our cancer center, we do have psychosocial oncology services and social workers, dietitians, and those services are available to all of our patients and families. And free of charge, I should add, and available to them for the extent of their journey here in the cancer center, so long as they are somehow active within the center. And that could even mean someone who's receiving follow-up on a yearly basis. It's important to know how to locate those resources and where you can find information about what's available to you in your community. So in addition to what you'll find through this webinar today, you'll also may look to hospitals, other community agencies, newspapers, community centers, and other organizations that might have information and resources that you can access and information you can gather. Again, we're going to be providing you with a more or less a comprehensive resource guide at the end of our presentation. But if you do find that you would like something a little bit more specific to your particular caregiving situation or your loved one's health circumstances, then please reach out to myself, and hopefully I can direct you to something that's appropriate to and relevant to your situation. But you will find quite a comprehensive list of resources that you can access. Now, speaking of resources, I've attached the flyer here for our upcoming workshop, our Powerful Tools for Caregivers workshop that is hosted in conjunction with our partners of the Windsor Essex Community Health Center. So I myself will be co-facilitating this workshop, which is due to begin in February of next year, starting on the Monday the 22nd and every Monday until March 29th. So it's a 6-week program. For those who find that they maybe can't commit to all of the sessions, even if you can commit to at least half of them, we encourage you to register and attend to wherever and whenever possible. And it will allow for a more in-depth exploration of some of those core concepts that we talked about today, specifically some really helpful information about how to become better communicators and how to express ourselves in a better and healthier way, and how to take care of ourselves so that we can ensure that we're providing good care to our loved ones. So again, that flyer will be available for you, and there's some information there as to how you can register. So I know we're ending a couple of minutes early, or concluding a couple of minutes early, but I was hoping we could maybe open up the floor to some questions or Q&A period. We've got some time here that I can address some of the questions that you might have, or something that might have sparked your interest in listening to this presentation. So we'll go ahead and open things up. And first and lastly, I just wanted to thank everyone for, again, taking the time to attend, and again, this in itself is a perfect example of providing yourself with a little bit of self-care, and taking time away from your caregiving duties and responsibilities to do something for yourself, and to help yourself become a better caregiver to your loved one. So again, thank you everyone for attending. How do we do this?
And hi everyone, if you go to the bottom of your screen, it's Sarah here, I'm the coordinator. You can see chat, raise your hand, and Q&A. So if you go into the Q&A box, you can ask different questions, and feel free to put anything in there, and Andrew will help out with that. So it looks like we do have one question.
Well, we've got a couple actually.
Oh, great.
So our first question comes in from Anonymous, asking, what advice would you give for communicating with someone who isn't very open with their own feelings? That's a great question. And the example that they've given is more or less relating to a particularly cranky grandpa. So we have had our fair share of patients who have been very resistant to the idea of talking about their feelings. And what we find is people are very resistant and hesitant to talk about those feelings with their loved ones sometimes. And the reason being is, they fear some form of judgment for how they might be feeling, or they're worried that, the answer they might get is going to be biased because that person is taking on, a perspective that they feel is right and not looking at things through a neutral lens or through an open lens. So sometimes, we offer individuals such as that the opportunity to speak with a professional about how they're feeling. They may be more apt to opening up and disclosing something when they know that they can do so in confidence and have their privacy and their confidentiality maintained. It's important to ask open-ended questions when asking someone how they feel, rather than something they can answer with yes or no. Ask them to describe their emotions, offer up advice or suggestions, or and always provide them, again, and remind them of the opportunity that they have to bring anything forward to you and keep those communication lines open. So I know this can be particularly challenging, especially for those who are not receptive to talking or to talking about how they feel. But again, practice makes perfect with these strategies for communication. We don't expect anyone to become an expert in it. But maybe look at starting to model some of that communicative behavior, similar to the concepts of assertiveness we were talking about. If you model a good communication for someone else, you might find that they tend to pick up on that and may actually engage with you in the same way, or be a little bit more receptive to engaging. So I hope that helps answer that question a little bit. It's again, there is no direct and no magic solution to that one. Veronica also asks if there are resources available at various facilities to help those without technology. So again, we here at the center do offer technology ourselves, and also have staff members that help with setting that technology up and getting it all logged in, and so that person more or less just has to hold out their hand and take that iPad and look into the screen and start participating. We have other technology we use within our in-house, such as interpretation services and phone line services, to make sure that we're communicating effectively with those who have language barriers or where English is not their first language. So we do oftentimes use an interpretation service to make sure that we are sharing information and doing so in a way that that person understands it and can make decisions based on having a clear understanding of what they're being asked. So I can't speak for other agencies and organizations as to whether they have access to the same technology, but if you're finding that it's difficult for you to either access or utilize that technology, be sure to ask for the assistance of staff in getting it all set up and logged on, just to make the process that much easier. Do we have any other questions? going to give everyone a moment. I don't know if anyone might be typing. If you're like me, you type with 2 fingers. It might take you a second to get that question out. Okay, so we have another question from an anonymous attendee um, asking about some of the best advice for a good holiday season. So as many of you have become aware, we are unfortunately looking as though our community is entering into the red phase of economic reopening again, or regressing back into that phase. Meaning that it is going to put up some barriers once again to gatherings and getting together as family. I know that there have been many who have taken the opportunity to come together far in advance to proactively celebrate and make sure that they did have the time and opportunity to spend with their families. But we always encourage, visits as long as you're maintaining social distance and doing it in a safe way and taking all of the necessary precautions. So I know the winter months can be a bit challenging for outdoor visits, but if they're, if looking at the forecast, there might be a nice day where it might be a bit, at least tolerable to be outdoors for a short time. Maybe look at having that celebration outdoors and maybe making some changes to how that celebration takes place. It may not be the traditional sit-down dinner that you're used to, but potentially, a potluck-style picnic outside where everyone can, again, maintain their distance in a non-confining space. But again, a lot of that is weather permitting, and we want to, of course, be sure that we're keeping our gatherings to a limited number, and with those who are within our social circle or within our bubble. So I hope that helps to provide a little bit of some advice as to how you can still have an enjoyable holiday season, an enjoyable time spent with family and sharing in traditions that may just require a little bit of change or some fine tuning to allow them to still be enjoyed. Another anonymous attendee did make mention of the fact that they did also obtain a second opinion, which ultimately did extend the life of their caregiver by a significant number of years. So firsthand experience of someone who did find doing so to be a helpful experience and something that was of value. So second opinions can be both validating and invalidating, meaning they can tell you that what you're doing is the right thing, or they can offer up some suggestions and alternatives for different things that may not have been considered. I think all of us really just want to know that we've at least explored or done all that we can to explore every option that's available to us, to know that we've aren't missing out on something, and we're receiving again the best possible care and treatment that we can. Okay, do we have any others? So Elizabeth is recommending our Powerful Tools for Caregivers webinar. She mentioned that she is currently participating. So thank you, Elizabeth, for your first-hand account of how you found the program helpful. This will be not be the first time that I've facilitated one of the workshops, and I can say that it's a great way for people to come together, not only under a shared experience, but to network with one another and to offer each other support. I do want to emphasize that these workshops are not intended to be support groups. They are more so educational and education-based, but that doesn't mean that it doesn't allow for opportunities for participants to connect with one another and even further their conversations outside of the program or after hours of the program. So it can be a great way of also networking with other people and getting advice from those who find themselves in similar situations. So it is a wonderful, wonderful program to attend, and not a very substantial commitment either. So thank you, for Elizabeth, for your positive review. And do we have any others? Okay, if no one else has any other questions, why don't we wrap things up there? So again, we will have information at the end of the presentation on ways in which you can, again, access resources, or even contact us for questions after the fact if something comes up, or something hadn't come to mind that maybe you were thinking about afterwards. So again, I'd like to thank everyone for attending and making this episode of our Palliative Education Day a success. Again, I know how hard it is to take time out of your day, and I really do appreciate all of you attending. So thank you so much, and I hope you have a wonderful evening and a wonderful holiday season.